Hello everyone, and welcome back to our channel. Today we're going to discuss about the care of women up to 6 weeks after childbirth, also known as the strong postnatal period. The journey of motherhood doesn't end at childbirth. In fact, another very important stage begins. This stage usually lasts about 6 weeks after delivery. During this time, a woman's body goes through significant changes as it gradually returns to its pre-pregnancy state. This period involves involution of the uterus and reproductive organs, meaning the uterus and other organs shrink back to their original size. Restoration of normal physiology, as the body recovers from the stresses of pregnancy and delivery. And the next is adaptation to the maternal role, as the mother bonds with her newborn and learns new routines. Finally, physical, psychological, and social adjustments, because recovery is not only about the body, but also about emotions and relationships. The care of women during the postnatal period has some very important objectives. Let's go through them one by one. First objective is ensure safe recovery of the mother after delivery. The first goal is to support the mother's body as it heals and gradually returns to its pre-pregnancy state. Second objective is to detect and manage complications early. Close monitoring helps identify problems such as infections, bleeding, or high blood pressure early, so they can be treated before becoming serious. Third one is to promote physical and emotional well-being. Recovery isn't just physical. Emotional support, rest, and proper nutrition are just as important for overall well-being. Fourth objective is to support breastfeeding and newborn care. Mothers are guided on breastfeeding techniques and essential newborn care, so they feel confident in looking after their baby. Fifth one is to provide family planning and health education. Postnatal visits are also the right time to discuss family planning options, healthy practices, and long-term care. The last one is to encourage maternal role adaptation and bonding. And finally, the postnatal period helps mothers adjust to their new role and develop a strong emotional bond with their newborn. In short, the objectives of postnatal care are to ensure safety, promote health, and strengthen the precious connection between mother and child. Bio. Now let's look at the general care of a mother during the postnatal period. These are the essential steps every healthcare provider follows to ensure a safe recovery. First, it's important to monitor vital signs, temperature, pulse, blood pressure, and respiration at regular intervals. Any unusual changes could be an early sign of complications. Next, we assess uterine involution. This means checking the uterus by palpating the fundus, looking for firmness, proper height, and correct position as it gradually shrinks back to normal. Another key observation is lochia, the vaginal discharge after childbirth. We check its color, amount, and odor. A foul smell or very heavy bleeding must be reported immediately, as it may signal infection or hemorrhage. Equally important is encouraging rest and adequate sleep, because recovery takes time and energy. And finally, a balanced diet is essential, rich in protein, iron, calcium, and plenty of fluids. This not only supports healing, but also improves the quality of breast milk. In short, general care after childbirth focuses on monitoring, nourishing, and supporting the mother, so she regains her strength and stays healthy. Next, perineal care is an important part of postnatal recovery. First, inspect the episiotomy or tear for signs of healing. Check for redness, swelling, or discharge. Next, ensure proper hygiene. The area should be washed with warm water after urination or defecation. For comfort and faster healing, a sitz bath can be provided. If the mother experiences pain, analgesics may be given as prescribed. Perineal care helps prevent infection, promotes healing, and improves comfort for the mother. Now let us look at breast care. Breast care is an essential part of postnatal care. Inspect the breasts regularly for signs of engorgement, cracks, or mastitis. Encourage exclusive breastfeeding on demand, as this helps both the mother and the baby. Teach the mother about correct positioning and proper latching for effective feeding. For engorgement, a warm compress can be applied before feeding to improve milk flow, and a cold compress after feeding to reduce swelling. Wearing a well-fitting support bra also provides comfort. Good breast care promotes successful breastfeeding and prevents complications. Now let us look at bladder and bowel care. Mothers should be encouraged to void frequently to prevent urinary retention. Always monitor for burning sensation or increased frequency, as these may be signs of a urinary tract infection. Adequate hydration and a high-fiber diet are important to prevent constipation. Early ambulation should also be encouraged, as it supports normal bladder and bowel function. Good bladder and bowel care helps in comfort, recovery, and prevention of complications. Now let us look at the prevention of infection and thrombosis. Strict perineal hygiene must be maintained to avoid infection. Mothers should be encouraged to stay mobile, as movement reduces venous stasis and the risk of clots. Careful observation is needed for signs of thrombophlebitis, such as calf pain or swelling. By following these steps, we can prevent serious complications and support a safe recovery. Now let us look at psychological care. Providing emotional support is very important. The mother's concerns should be heard with patience and understanding. Encourage mother-infant bonding through practices like skin-to-skin contact and rooming in. Mothers should also be assessed for postpartum blues, depression, or psychosis, so that help can be given early if needed. Family members must be involved in providing support and care. Psychological care builds confidence, reduces stress, and strengthens the bond between mother and child. Now let us look at health education during the postnatal period. Mothers should be guided about the benefits of breastfeeding and the correct practices to follow. They must be informed about warning signs that need immediate attention. These include heavy bleeding, foul-smelling lochia, fever, severe abdominal pain, calf swelling, persistent sadness, or suicidal thoughts. Family planning methods suitable for postpartum women should be explained. Mothers should also receive guidance on postnatal exercises, such as pelvic floor and abdominal exercises to regain strength. Finally, advise a follow-up visit at 6 weeks, or earlier if complications arise. Health education empowers mothers to care for themselves and their newborns with confidence. The postnatal period is a critical phase in a woman's life, marked by physical, emotional, and social changes. Effective nursing care during this time protects the mother's health, supports successful breastfeeding, strengthens mother-infant bonding, and promotes overall family well-being. That's all about care of women up to 6 weeks after childbirth. If you liked this video, don't forget to like, share, and subscribe to my channel for more nursing learning videos. Thank you for watching, and keep learning.